Hello, everyone. Welcome to another episode of Your Health Matters here with Karl Sterling. I am very happy, honored to be your host. And of course, you're listening to News Radio 570 WSYR, also available on 106.9 FM. Folks, we've had a lot of great success here, which you already know about. We talk about it every week with the biodensity, bone density builder. So we had another lady come in this past week who didn't change in her DEXA scan scores just yet. However, the doctor upstairs, you all know him, you all love him, Dr. Joe Barry, did a body composition on her. Her body fat, body composition has shifted, and she weighs 1 pound less, but she has 4 pounds muscle. So she actually lost 4 pounds more muscle. She actually lost 5 pounds of fat. How do you like that? And we know that she's stronger because she's lifting heavier weights. Her DEXA scan comes up soon. And as you know, we've had several people come in with DEXA scans that are in, let's say, osteopenia, osteoporosis. And because of the type of contraction that we're doing on this machine, which is an isometric, let's say, osteogenic max force loading type of contraction to max force your muscles into the tendons, into the bone. Well, as Dr. Peter Attia says, and I think my special guest here today would agree that when we load our muscles, that chemical, let's say that mechanical action will cause this chemical hormonal reaction of soft tissue bone growth. This is what we're talking about. Muscle, the organ of longevity, the organ to keep us moving longer, the organ of metabolism, the organ of moving well, right? So our biodensity machine is here for you to check out. We want to make sure that you know that it's here. We are getting results, and the max time on the machine is going to be about 15 minutes. Okay, you don't even have to dress special because you're not going to break a sweat, but you're going to do some force loading of those muscles. You're going to cause those muscles to get stronger, and beautifully, you're going to also train type 2 muscle fibers very effectively so that it can help you with, in case you're sprinting or jumping, but also associated with balance. We can get those babies working together because, you know, we have this thing called, I'm sure we'll talk about today, called age-related obligatory muscle decay, if you will. I kind of made that up. I half stole it from Michael Joyner at the Mayo Clinic, though, so I give him credit. Without further ado, though, I want to introduce my guest, and we're going to be talking about how, let's say, osteosarcopenia. This is new to me. I didn't know about this until my special guest told me about it a few days ago. It's that bone and muscle loss that we tend to experience as we age. Let me tell you a little bit about my special guest. His name is Dr. Lucius Pomerantz, based in San Diego. He's an orthopedic surgeon and an upper extremity hand specialist at Synergy Orthopedic Specialists Medical Group, San Diego again. He's also a health sciences assistant clinical professor in orthopedic surgery at University of California, San Diego. His priority is to return patients to the activities they love and to keep people moving. Does that ring a bell, folks? Because don't we talk about this every week? You got to keep moving, got to keep moving. Okay, so he's a strong believer, as I am, in the mind-body connection and that much of our well-being is guided by our ability to move. So it's my pleasure to have as my guest today, Dr. Lucius Pomerantz. Doc, how you doing, man? Thanks for joining me.
I'm doing great. Thank you for having me, Carl. It's an honor.
Oh, my pleasure. My pleasure. We've exchanged a few messages here back and forth over the past couple weeks, and I'm really glad I found you because what you speak resonates with me, resonates to my ears, just makes me I had to talk with you because my listeners,
Yeah,
see, we have a very well-informed, educated group of followers on this show here, right? So they listen every Sunday and they know about this stuff, but I couldn't think of anybody better to talk about it than you. My first question,
yeah.
this thing about osteosarcopenia, like muscle mass, bone density, and how that changes as we age. Tell us about this. Like, when is
Yeah.
it we should be starting to think about muscle mass? When does it become like, hey, wait a minute, I've got to get on top of this so I can go into my last decades moving well?
Sure. Yeah. So, there's a lot in the term osteosarcopenia. It seems like osteoporosis is very much on your radar and you're working on it. And then there's sarcopenia, which is loss of muscle. Both of these are age related. And now there's a term, it's relatively new, of a combined thing where people have osteoporosis and sarcopenia. Um, it makes intuitive sense that this would happen. And I like the idea, especially because it shows how linked these things are, bone and muscle. You can't really have one without the other. They work very well together. And only now are we really trying to figure out the connections beyond mechanical, the hormonal releases, the biochemical changes. It's a burgeoning science, and I think it's exciting. But the term osteosarcopenia kind of really shows that it's all linked. And then going back to how, when we should be starting to think of all this stuff. I mean, unfortunately, we really should be thinking about our bone strength and our muscle strength way before we're 30. It's been shown that kind of at the age of 30, we start losing bone. That's kind of the max bone strength that we reach, and it's a similar age with muscle. And unfortunately, age is inevitable. Things change, things will deteriorate, but fortunately, these tissues are adaptable, and we have the ability to counter, to fight back a little bit against the aging process.
So it doesn't necessarily have to be all drug infusion and medical medicine related. Is that correct? As far as
Absolutely correct.
as far as the bone part, I mean, we know we can exercise muscles, resistance training, and various forms of that, but a lot of the medical world that I'm in touch with, and I don't say this with any disrespect, I actually don't even know if some of them really are aware of the fact that resistance training actually does help, and keeping moving helps, and impact forces help bone. I'm
Oh
answering my own
yeah,
question, but I want to hear
yeah,
your
yeah.
answer. It
No,
doesn't have to
no,
be the drugs, right?
no, absolutely not. The drugs, and I think, I mean, maybe perhaps doctors do a poor job at communicating things, and we often, and the way our medical system is set up, is we're catching people who have fallen to a certain level, and now we have to do things to get back to a certain point. But there's so many other steps that have been missed along the way, and the most important things for your bones and your muscles is being active and resisted training and nutrition and starting early, if you can, but it's never too late.
Exactly. Yeah, yeah, and that's good to know too, because the demographic we work with here in my clinic right here primarily is 60s and up, more so even 70s, and we have a lot of people in their 80s. We have quite a few in their 90s who come in.
Awesome.
It's beautiful. It's nice to see them moving. And some of them, when they came at first, they weren't really moving that well, and most of them are moving either well or much better.
Better is all you can do. That's great. That's excellent. And yeah, I think you've alluded to following along with Peter Attia and his propagating the idea of not only health span or lifespan, but health span, your quality of life, and mobility and muscle and bone strength are very much part of that.
Thank you for saying that too, Doc, because folks, you heard him say it right from Dr. Lucius Pomerantz's mouth. He said about health span within the lifespan. We actually talk about that, exactly those words, every single week. Because we can have a long lifespan, but what if we're 90 and our health span is only 70 years? We have 20 years where we're not so healthy or we're bedridden. God forbid. Folks, we got to head out for the first break here. And then when we come back, we'll be back with Dr. Lucius Pomerantz to talk more about bone health, keeping moving throughout the lifetime, and increasing that, let's say, health span within the lifespan. So we'll be back in a couple of minutes. This is 570 WSYR News Radio 570. My name is Karl Sterling. You're listening to Well, Your Health Matters. Be back in a minute. All right, gang, we're back. We are back, and we're talking about bone health with Dr. Lucius Pomerantz, based in San Diego. Well, Doc, I have a question for you. So when you talk about, let's say, keeping people moving, I know that's one of our first things that we communicate is we both have a similar mission here, right? Keep people moving.
Definitely.
Let's talk about fractures. And you're in the field of seeing those things, I'm sure. I mean, no matter what extremity, upper, lower, I mean, people fall down, they can break a hip, an ankle, they can break a wrist, a hand, a finger, dislocate a shoulder. Can you maybe enlighten us on, again, why it's so important to keep moving, to maintain sufficient muscle mass as we age? Because we know our fracture risk goes up and a lot of bad consequences can go along with it. So I'd love to hear some stories or just your words of wisdom on this.
Sure. Yeah. Well, there's a lot. So yeah, orthopedic surgery. We're surgeons, and orthopedics. It's bones, but then things associated with bones: the muscles, the joints, the tendons, the ligaments. Um, and fracture care is a huge part of orthopedic surgery. It's something we deal with on a daily basis, and it's often the reason why we got into it is there's a broken bone, we get to fix it. But it's also part of the medical system. You know, there's probably a lot of things that could have happened before the patient broke their bone, but now they broke it and now they're seeing us and we're catching them and we've got options. We can hopefully help them get back to doing all the things they're doing. And yeah, broken bones are an interesting thing. There's often this what we call biphasic time where the young people who perhaps maybe don't make the best decisions and find themselves in situations that they probably regret, find trauma and they hurt themselves. But then as we age, our bones get weaker, our muscles get weaker, our balance goes, and what might have been just a small fall turns into actually something quite catastrophic: a broken hip, a broken vertebrae. Sure. And those can be life-changing, life-shortening. And even with excellent orthopedic surgery and our techniques and our approaches to things, we can get people walking literally the next day after a broken hip, sometimes the same day. But still, the metabolic toll of healing from a broken bone as big as a hip or the spine, and then the trauma of surgery takes a lot out of these patients.
Yeah.
And we're seeing even with even if their bones weren't bad, often it is osteoporosis that contributes. But if their muscles aren't good, if they have weak muscles, if they haven't been working on having a solid muscle base, they don't recover from these traumas as well as they could have. The muscle being a metabolic tissue, it's not only something that keeps us moving, but it's also the storage of our amino acids, the proteins that we make to heal and recover. And if we don't have that at baseline, it's really hard to recover from broken bones.
Well, I'm sure glad you said that. I really just got into a thing recently reading about all kinds of things amino acid related and how we have to have those for muscle health and for overall health and healing. But I want to talk about that more, but I have a question. So do you have any data just in the head? Not like I need a reference, IRB reference or anything, but an approximate data or statistics that you can relate to us or relay to us, I should say, about, let's say, consequences of a fall. I mean, I know a lot of us through my lifetime anyways, and a lot of us, I remember one of my aunts, a great aunt, was like 6 years old, fell down, broke a hip. You know, that was it for her. She lived a few years, but she was in a wheelchair and nursing home eventually. But before that, she was moving around. But I'd like to talk about, not to scare anybody, but we also, I think it's important to think about reality and the importance of planning ahead in your mind and then in your actions to work out and do the things necessary to maintain muscle mass so that you have stronger bones, so that if you do fall, you don't break one as easily. Like fracture risk reduction, I hope. Tell us about some of those things, like some of the bad
Sure. Yeah.
stories.
The numbers. I mean, going back to the big picture, falls are one of the biggest reasons why lifespans get shortened. And part of it is certainly as we're older and our bones are weaker, they break easier. And then the costs of trying to recover from these broken bones and perhaps the subsequent surgeries that you needed. And these are very general numbers, and it's easy to remember. They're not the exact numbers, but I will tell patients with a broken hip and talk to their families and all that kind of stuff. But about a third of patients can get back to the level of mobility that they were at before.
Okay.
If they're independent ambulators, they can get back to independent ambulation a third of the time. That leaves the other time, 2/3 of the time, they don't get back to that level. Sometimes they don't make it a year, a living lifespan. But then a lot of patients take a step down in mobility. They go from being completely independent to now needing assistance with a cane or a walker. Or if they were already in a cane and a walker, now they're in a wheelchair, and it's a step down. And so these injuries can be, again, life-changing, and doing everything we can to prevent it is important.
Speaking of prevention then, where would you start with advice for people? What's the first, or where is the first place they should be spending their time? And I'm talking about the big picture here. Like, we can go down all these different avenues of, let's say nutrition, exercise, and medicine, but let's talk about exercise. What should they be doing to help themselves to build and preserve, maintain muscle mass, lower fall risk, fracture risk? Where do they start?
Sure. So exercise, that's probably the most important thing. Exercise. And by exercise, it's not, you're not doing CrossFit workouts that are incredibly intense for 2 hours a day, not that at all. In fact, there's a lot of studies showing 20 minutes of walking a few days a week make huge improvements. And people will often ask, what's the best exercise? What's the best exercise? I just tell people it's the exercise you're going to keep doing, that you like doing, that makes you happy. That's the exercise that you should probably keep doing. Sure, there's a lot of debate on specific exercises, what's going to provide the best resistance, what's going to give your bones the forces they need to see to remodel, to stop breaking down. Sure, weight-bearing exercise is probably best, but if you really like swimming, swimming's not bad. Swimming's great. Cardiovascularly, you build muscles. The hormone release from your muscles does help your bones. Stronger muscles help your bones. So while there are probably more efficient exercises for bone strength than swimming, if swimming's your thing, do swimming. But it can be as simple as walking. If you like weight training, I think that should be a huge part of it, trying to grow some muscles. And weight training is interesting. It doesn't necessarily mean you need to be in the gym like Arnold Schwarzenegger, doing 300-pound bench press. I've gotten into simple things, not simple, but the things called the steel mace. It's just this stick with a weight on the end, and you learn to just move it around in space, and it works what you want it to work. It could be your core, it could be your arms, it could be your legs, it could be different weights. It can be very light. You can do these flowy movement exercises, or you can kind of do a heavy, simple movement. So it's going out there, experimenting, finding what you like to do, and then keep doing it. That's the best thing.
I love that. I love it. So we're going to head out to a break in a minute, bottom of the hour news break. You're saying things that just resonate so much with me, and I know with a lot of the listeners here today. One of the things we also preach, if you will, is do the exercises that you will keep doing, like you say, because I don't do anything I won't want to do. I will tell you, I'm guilty as charged, Doc. The only time I do it's when I go to the gym to work out and I have a coach and he tells me what to do. That's it. Otherwise, I'm going to do what I want to do, but at least it's better than nothing. So, folks, we're going to head out for a break here. Bottom of the hour. News is coming up right now. And you are listening to Your Health Matters here on 570 WSYR. We'll be back in a couple minutes. Thank you. All right, we're back. And we're here with Dr. Lucius Pomerantz from San Diego, orthopedic surgeon. And we're talking about bone density, muscle mass, sarcopenia, osteosarcopenia. Folks, I just also want to tell you that this is the first episode that we're going to have what they call Your Health Matters Overtime. So when this show is done, when it's off the air, you can go to one place only and find the extra piece after the show is over called Overtime, and that would be at karlsterling.net. Karl with a K, karlsterling.net. Go there because we're going to go a little bit overtime with some extra info that won't air here today on the show. All right, so we are into bone health, muscle health, and Doc, I'm curious to know what type of things in life, like life events or age-related things, or events, maybe illness, medications, what can cause, I know there's a million things probably, but what are the primary things that might be likely to cause diminished bone density? Even if somebody's working out, there's
Yeah,
still a chance that bone density can diminish for various reasons.
for sure. Yes. I mean, bone density will diminish over time. We know that. How fast it goes and the severity in which it approaches, some of it is genetics, and we can't change that. But there are a lot of things that we do in our younger years, especially, that influence things. Alcohol intake, excessive alcohol intake, is definitely something that has been shown to diminish bone strength. Part of that may be just poor nutrition. There's also a lot of metabolic things that alcohol changes, and
Rut row, because I had a lot back in my day. No more, but
yeah.
yeah. I'm
Well,
being careful. I'm being careful. I'm clean. I'm clean.
good.
Go
Yeah,
ahead,
yes.
Doc.
And everyone when they're younger does it. It's just there comes a point, and what that point is probably also genetic, but it's something to keep in mind. Diabetics, and unfortunately, type 2 diabetes is clearly an epidemic, and a lot of reasons why diabetes may contribute to poor bone health. But part of it is it's a pro-inflammatory state. With inflammation, things start breaking down more, and bones, unfortunately, are part of that. So diabetics have definitely weaker bone. Lots of other things contribute. I mean, unfortunately, there's situations that come up where cancer and the treatment for cancer is something that will weaken bone, whether it's chemotherapy or the steroids that people have to take. Lots of reasons why people have to take steroids beyond cancer treatment, but it could be autoimmune disorders or other situations that come up, and if you're on these for sustained periods of time, your bone is weakened.
So is prednisone like an example of a steroid? Would that cause
That
problems
is,
potentially?
yes, a corticosteroid like prednisone is for long periods of time. We're not talking a couple days kind of thing, but
Yeah.
often the sustained treatment for these things does weaken bone.
I didn't know that, and I'm glad that we brought it up because, I've known in particular some transplant patients who are on prednisones, high dose at first, and then long-term
Mm-hmm.
lower dose, usually could be for decades. And I
Yeah,
can only imagine that that can add up over time too. Yeah.
for sure. And it's the balance. While steroids are not a totally benign thing, they can be very helpful for situations like a
Absolutely.
transplant. I mean,
Sure.
the
It
the
could be
the fact that we can
life-saving.
take
Yeah.
yeah, the fact that we can take an organ from someone else and put it into another person, and they live, and they can live a pretty full life, is amazing.
Yeah.
Yes, unfortunately, part of that is often taking these anti-inflammatory steroids to suppress the immune system somewhat. And a drawback to that is that bone strength is diminished.
Sure.
And it's something that you have to be aware of if you're on these medications, and should be followed. And that's a situation where sometimes medications to strengthen the bone, or at least prevent bone loss as best possible, are necessary.
So how about menopause?
Yes, definitely neglected mentioning that menopause is a huge contributor to loss of bone strength, along with just the age-related changes and bone loss in that regard. There is there's loss of bone that's accelerated when we reach that age of menopause. Part of that is the loss of estrogen, or the usual amounts of estrogen that a young woman might have, and with
Sure.
that, bones don't get the same hormonal influences they usually get, and the bone turnover is accelerated, and become weaker faster. So women are certainly more likely to become osteoporotic than men.
Sure, sure. That makes sense. And that's actually about probably 80% of the people here who have osteoporosis are post-menopausal women. Some are maybe in it, but a lot of them are out of, post. And then we have men too. I mean, it can happen to anybody, right? It's not, genetics and all these other
Yeah,
factors potentially. So, well, along that line then, let's maybe go down the path of, since now we know that really all of us are going to lose bone mass over the years, bone density. I mean, it's just going to happen, right? It's an age-related thing, as is Dr. Joyner's thing. He talks about age-related obligatory muscle decay. And if we can ramp ourselves up being well, well strengthened and moving well in our 70s, go into our 80s, or as other people say, our last decade or decades. That sounds morbid, but at the highest level of movement we can, so that we have a good 80s, we have a good 90s, or maybe 100. I'm going to live to be 100, Doc. I'm telling you. Just mark my
hey.
words, and you'll be invited to the party because it's already planned. June 5th,
Nice, love it.
2061, baby. Right here. But so we know what we could be facing is this is going to happen. We need to stay on top of it. So we know exercise is good, resistance training is good. Let's talk about other things. How about supplements or nutrition? What do you
Sure, yeah,
recommend in those
nutrition.
arenas? Yeah.
So, I mean, wading into the arena of nutrition, you've probably gathered there's some
Oh man.
people who are very aggressive in how they think, and what's funny is it
Yep.
can be completely on opposite sides of the spectrum. There's being vegan and there's being all meat diet, and
Oh my gosh, I
I'm
know.
not going to go into all
And a lot
that.
of them are like MDs who are saying this. So I mean, who am I going to follow? Because
Right,
this MD
it,
says he hasn't had a green thing in 2 years, and the other one says I haven't had a piece of meat in 20 years. Anyways, generally
and it makes
speaking,
it
and we're not
really
going to hold
hard.
you
And
to,
you can only imagine. You
yeah.
can only imagine how it is for patients who don't have the degrees, who are trying to be proactive
Mhm.
and learn. And you know, I guess it's my own biases and philosophy of kind of finding a balance. A
Mhm.
balance is everything. Physical balance is important, and balance in how you approach life. Avoiding extremes is often probably a good way to go. And so nutrition, it's clear nutrition is important in influencing bone and muscle health. And within nutrition, there's the components of why we eat. Proteins are amino acids, and amino acids are the building blocks of essentially everything. Our muscles are essentially pure protein, whereas other structures in our body are a lot of protein combined with other things.
Sure.
Um, Bone is calcium and phosphate that have been, we'll say, calcified within a bone or a protein matrix that kind of creates the rebar of the concrete, for
Sure.
example. And
Doctor,
so, yeah.
I'm sorry to interrupt. It's just that I'm just looking at the clock here. We got to go to a break.
Oh, all
Our
right.
last
We'll
break.
continue.
So stay with this nutrition thing, okay, folks? So, Doc, let's come back to nutrition. We're gonna head out for a break, folks. It's the last break. Come back for the last quarter. This is News Radio 570 WSYR. This is Your Health Matters. My name is Karl Sterling. We'll be back in a couple of minutes. All right. We're back for the last quarter here with Dr. Lucius Pomerantz. And Doc, we were talking about nutrition. So we left off with muscle. It's essentially pretty much all protein. So we got the well, let's
Yeah.
have you continue on that.
So nutrition, however you view it, I see it as the ability to take in these small components that build our body and fuel our body. And starting with proteins, amino acids, these amino acids, our body uses 20 of them to create everything. And we'll say 9 of them are essential. We have to get them from our diet. And that's just a part of how important diet can be. You have to be getting these things or you can't build what you need to build. And so whether you get your proteins from meat or dairy or animal products, which are great sources of protein, or you get them without those, and you might have to be eating a lot more of certain things to get adequate amounts of protein, but you can certainly get your 9 essential amino acids and complete proteins from non-animal based sources. But you got to be proactive and do it. And the amount of protein that you need to get is also important to keep in mind. The U.S. daily recommended allowance,
Sure.
their level of protein is kind of, this is what keeps you from getting sick. So that's
Mhm.
certainly not kind of where I think most of us want to be, who are trying to build muscle, keep active, be proactive. And so I usually kind of recommend the 1 gram of protein per pound of body weight to start with. And you might need to do more. And maybe, you got to figure out what's going to work best for you as far as protein intake, and what your goals are. Some people want to be huge muscle guys and they might need more protein. Other people may not need to get that much. But the key is, whatever your source is, part of a balanced diet, getting those proteins. And sure, a protein shake, you could just drink protein shakes all day and get the amount of protein you need, but you're probably missing out a lot of other micronutrients and sources
Yeah.
of fuel that you need. So in general, I think supplements can be a part of a healthy diet, healthy life, but your focus should be getting most of your calories, most of your nutrients through a balanced diet. And that's on the edges of the grocery store, whether it's the animal
Right.
products or the fruits and the
Yeah.
vegetables, staying away from the processed stuff, and building from that, based on what your goals are.
That sounds good. Yeah, they always say shop the perimeter, right?
Yeah, yeah, it's
Yeah.
great advice.
Yeah. Pretty much the way it always is in every store. You go in and that's where the better stuff is. Now, I have a question. It's very specific, and I'm going to ask this, and I don't want to offend anybody. But anyone who listens to this show regularly knows that I used to be obese. I'm 6'2". I used to be, 289, 290. That was a long time ago when I was a drummer for a living. And I'm no longer that for a living because I got burned out. I needed to change careers. I had health problems. I had a lot of health problems and I was scared. So, I dropped at this point, what, 80 pounds, 70, well, 70 from then,
Awesome.
whatever. I'm just redistributing body weight too, because I have a lot more muscle mass now than I did last year, a year ago this month, but I weigh more. But I lost body fat and my body fat went down. So I'm really excited, right? So the bottom line is, I've been obese. That's the thing I want to say. So for anyone who out there who's listening who may fall into that category, I can relate to you. I've been there. I'm wondering, my question, which I want to direct to you, Dr. Pomerantz, is would that gram of protein per pound of body weight, would that also apply no matter what our body fat percentage is? Like, let's
Uh,
just say somebody weighs 400 pounds, but 200,
sure.
would it be good for them to lose 200 and then they'd be in perfect body composition? What's, how does that work into this?
It's a great question, and we unfortunately have to keep that in mind. You probably know the numbers of people who are obese and overweight in the United
Yeah,
States, and
it's a
the
lot.
numbers are unfortunately astronomical, and it creates a lot of health issues. And the recommendations for protein intake, I think, are more based on the ideal body weight.
Okay.
Um, but that being said, yes, if you're 400 pounds and your muscle mass is much, much less than what would be usual for a person who's that big, perhaps that might be excessive protein, or at least not utilized in the way that people would want. And it might be a lot of
Sure.
work to try to get that much protein. So you, as an obese person who's 400 pounds, maybe they don't need that much. That being said, the NFL offensive lineman who's 350 and a
That's a
lot of
different
muscle,
deal.
to maintain that mass, I
Oh,
mean, you
yeah.
hear of what they're doing dietarily to get the proteins to maintain that mass, and they have to get a lot of
Oh,
protein.
it's wild, man. When I was a musician, when I lived in Chicago for a couple of years, there was this place I used to play at downtown, is some of the bears would come into this bar. It's like they were sponges too. I mean, they could really throw down a lot of beer. But those guys, man, and I'm 6'2". I was a skinny beanpole back then, but I mean, holy cow,
Yeah.
these guys are like
I mean,
enormous. Their bicep is bigger than my quad. I mean, it's unbelievable. Pretty impressive.
some human beings, yeah, that 99th percentile of human being are extraordinary, and they have to do extraordinary things to
Yeah,
be the way they are,
they
and not
do.
all of us have to do those things to be an effective, proactive, healthy person. Um, before I forget, just awesome that you were able to lose that weight. It can be extremely difficult, and the fact that you did it, live it, that's incredible.
Well, thank you, Doc. I really just did the work, and I was scared, so I had to. Otherwise, I was afraid I might, wind up in really bad shape. So, um, radio minutes, folks, you know how they are. They're the fastest minutes of my life. We've got about 2 minutes left, Doc. But then we're going into overtime, folks. KarlSterling.net, Karl with a K. So you can catch a little more after the show. In the next minute and 40 or so, or next minute for you, Doc, any words of wisdom as we close out the radio portion of the show here? Any words of wisdom,
Uh,
suggestions, takeaway messages?
yeah, I mean, I try to live it too. Be active. Mobility is so important, and you want to keep it. Keep moving and do the things you love to do. You're going to be mentally better. You're going to be physically better. Those two feed off each other, and you kind of create this feedback loop where you're going to be better off, and your health span is going to be much better by being active.
Yeah, I appreciate that a lot. Really appreciate this, Doctor. Thank you so much for joining me. Thank you.
Yeah, it's been an honor.
Well,
Thank you, Carl.
well, you and I are going into overtime. I got a couple things to say before we sign off. Folks, you know where to reach me if you need me. As always, you can call, text, email, 315-935 7488. 315-935-7488 is my phone number. I probably won't answer, but you can leave a message and I will call back. And you can also text that number. You get a faster response for sure. You can also visit karlsterling.com for all things neuromotor training here at our clinic. That's Karl with a K, of course, and karlsterling.net for the overtime version of this show, which when you go to .net right after this show airs, is going to be the first show, top of the list. Just go towards the end and hear what's going to be said next. Dr. Pomerantz, thanks again, my friend.
Thank you.
All right, we're going overtime, folks. Have a great week in the meantime, and we'll see you soon. Thanks so much for listening. This is Karl Sterling, News Radio 570 WSYR. Your health matters. See you next week. All right, gang. So we're here for overtime. Your health matters overtime. We're with Dr. Lucius Pomerantz of San Diego, orthopedic surgeon, and we're talking about bone density. We're talking about sarcopenia, muscle mass, osteosarcopenia. And if you heard the show that just aired, you know that there are a lot of things we can do. So this is a little bit more freestyle here. No ads, no commercials. We can just go with the flow.
There you go.
Yeah. So when it comes to this whole thing about, I've been thinking a lot. The people I see who come in here, um, well, some of the people who come in, very, very, very overweight. And also, I argue to say under muscled because they haven't been moving as much. And what's really inspiring is for those who come in, do the work, shed. And it's not going to happen fast. And especially usually when we're in our 70s and 80s, I'm not seeing people shedding a lot of fat quickly. But what I am seeing is as they get involved in what's appropriate for them, challenging, but not going to kill them or anything, resistance, cardiovascular, and then we can get into balance and all that stuff. But just doing the work to increase mobility, stability, agility, balance, and functional movement, even something as simple as getting up out of a chair. I mean,
Yeah.
seriously, They wonder why we do squats. Why not? I mean, sitting is a squat, and getting up, you're kind of getting out of a squat. Um, I feel like I'm kind of going a little ADHD here. That's more normal for me. But my abstract thinking comes back around to this under-muscled aspect of the population, I think, in addition to
Yeah.
too much body fat, where I think, a lot of us have been, I've been there. Um, I can't agree with you more than I've ever agreed with anybody about this keeping moving thing. You practice I am actually going to get to a point. You practice a Brazilian, is it Brazilian jiu-jitsu?
Yeah, yeah. I mean, it started off Brazilian, but now the whole world's got it. So we'll just say jujitsu.
Okay, okay, that's cool. So I'm curious to know, with you doing that and your expertise and what you do as a surgeon and a specialist, when you're suggesting people to increase their health span when they're in their lifespan, I know we already talked about it during the actual show, but what other things are you recommending? Like if you're having a conversation with somebody, you're saying, hey, you're talking to me, I'm a patient, I just had
Yeah,
hand surgery or something, like, okay, Carl, look, man, here's what you got to do. What are you going to tell me?
yeah. So we kind of talked a little bit about this on the radio show, is finding the
Yeah,
things you
yeah.
like to do. And part of that is the whole intrinsic versus extrinsic motivation. If you're
I
trying
was
to
so
lose
hoping
weight
you would
because you
say
want
that.
to,
Thank you. I was so hoping
yeah,
it. You
hey,
you just hit
you,
what I
you,
want on the head without me
you, you,
realizing the
you,
words.
you
Thank
did
you.
not prompt me. We fell into it. So
No, that was
yeah,
beautiful.
to sustain things and be happy with it, you need that intrinsic motivation. It's got to come within you and be who you are, as opposed to wanting to look good for your friends when you go to the beach. While that
Yeah.
can be motivating and you can achieve results, it's not the best way to sustain your motivation. If you intrinsically want to be in better shape so you can play with your grandkids,
Yeah.
that is something that's going to be much better motivation.
That's me.
Um,
I got four of them.
oh, congrats.
Yeah, man, it's
Awesome.
great.
Um, and so finding what intrinsically motivates you is going to be important. Um, and so function is usually a big thing. And sometimes as a coach yourself, you're going to have to lay out and maybe open people's eyes to what is a motivating factor. They may not be thinking about their grandkids for whatever reason, but if you open their eyes to, like, hey, your grandkids are going to want to play
Yeah,
and
that's
you're going to want to
true.
spend time with them, and that might click and they go, oh, okay, I'm going to have to learn how to pick this thing up from the ground because that's what I'm going to do with my grandkids.
Yeah.
And that builds a certain motivation that is sustained. Other things that can keep people motivated is a social interaction, and so doing things with other people, and that can be as simply going for walks with other people. Here in San Diego, where the weather is great year round, you see people outside doing their yoga classes all together at the beach, or these huge groups of bicyclists doing their road cycling on the hills, and that's a social interaction that they
Yeah.
derive some intrinsic satisfaction from that keeps them doing those things. And then why I do jujitsu? Well, I like doing it. I get some intrinsic satisfaction of the chess match and the physical exercise, but some of these guys are great friends. I like to be around them. We like to talk about things after beating each other up and
Yeah, that's
get
pretty cool.
ideas from each other and learn from each other. And you're interacting with people you might not otherwise interact with. I might get very much into my world of being a surgeon and not get to interact with these guys who are great guys, but have a completely different career and life trajectory and doing different things. So uh, those are the intrinsic motivations that I get from doing the exercise I do, and that keeps me going with it.
Yeah, I really like that. One of the things that comes up frequently, like every day almost in some way, shape, or form, is the social interaction aspect. I don't know very many people who don't want to socialize. I mean, I
Yeah,
know a few who kind of like to be alone, but not that
yeah,
many, because then they get lonely, and it's really not a healthy thing. And I've been if there's anything I'm known for around the world, and trust me, I'm not tooting my horn. I'm just kind of a normal guy who got lucky and worked hard, but also been blessed and lucky to meet up with, work, research with some leading neurologists in Europe and Mexico,
Awesome.
South America, here, and Asia and whatever. The thing is I see now the being let's seen as like a specialist in helping people with Parkinson's to restore to whatever degree we can movement, balance, rotations,
Yeah,
gait, maybe even cognition, reduced, manage disease symptoms. Let's put it that way. Um, we see a lot of times when they come in here, depression. Of course, statistically, depression is the number one non-motor symptom of Parkinson's, followed statistically by anxiety as number two. It could be that tremor is causing them to feel like, oh, I can't go out to dinner now because I'm going to spill things on me and it's going to be embarrassing. And so I'll just stay home. And therein starts the cycle of this spiral downward socially into maybe depression because they miss their friends, or they won't go golf, or they won't go, and that's
yeah,
actually very, very sad. So I love the idea of groups, which is one of the things we do here is trying to encourage groups. This is like a cool, it's a really cool
great.
place. If you're ever in Syracuse, which I can't imagine why you would be, but you did go to school in Albany, right?
I did. I did.
So
I was in Albany.
you know where I am. It's only 2 hours away, but
I know what the
well,
weather's like.
yeah, yeah. We have sun today. It's unbelievable.
Yeah,
Unbelievable. Uh, it's a great place because we have a community here and people love that. A lot of the women are widows. We have one guy who's a widower, so like they're alone. So
yeah,
so I'm glad
yeah.
you brought that up because that social interaction is so huge.
It is, and I say that as an introvert, and by definition, I kind of did get my energy from being alone, being by myself, and that's where I get my energy. But I also know that I do enjoy being with my close group of friends, and that is valuable, and I get something from that. And so even if people don't like being at a huge party and staying up
Sure.
late and being the life of that party, that is definitely not everyone. It's definitely not me.
Yeah.
I
Same
think
here.
everyone, whatever your personality is going to get something from some sort of social interaction. Um, and unfortunately, as we age, we tend to lose it. Our social circles contract for various reasons.
Yeah.
Um, and if we're not proactive about it and we're perhaps getting depressed because of it, it kind of creates this vicious cycle that we become isolated and then we don't want to do things and then we become more isolated. And so, yeah, if you can bring as a coach, as someone who's helping people, if you can bring that social thing together, I think that in itself will keep people going and make them happier.
Yeah, it is nice to see when they do, well, a bunch of things when let's say, restore some ability, regain an ability they think they had lost or they sort of had lost, um, so that they can move better, do something better, and then a lot of times that leads to hope and empowerment because a little bit of hope from something regained. I got a story for you.
Yeah,
And I'm sorry because this is your platform, but I'm stealing it for one
no,
minute.
no,
Okay.
do
Because
it.
some of the people who listen, they've heard this story, but I teach a lot in Mexico. I usually go about 3 times, 4 times a year. Because really in Mexico, some of the cities like Monterrey, San Luis Potosi, mm, Puebla, and Mexico City, they have some very highly advanced neurology clinics.
Mm,
The rest of Mexico, I can't really say that's the case. But pretty much everywhere in Mexico, um, they're lacking on resources and education for things like, well, a lot of things, especially when it comes to health and fitness and longevity and movement disorders and this and that. What is it? Why do I get Parkinson's? Well, we can't really say why exactly. I mean, I've had experts on the show. They don't know why. They can speculate why. But
yeah,
bottom line is, managing these things. There's usually something we can do to help people, or maybe quite a few things. And kind of circle back around here. This one lady, in Monterey, my first time there 6 years ago. 42 years old, Parkinson's for 17 years. A lot of early young onset there, and I think a lot of it's environmental related to jobs, water supply, big thing, horrible water. But regardless of that, we're teaching a class after being the speaker after these neurologists, and then I change, get into workout clothes, go, and I said, what are we going to do? Because I didn't know what to do, I said, well, I don't know. What do you want to do? Who has trouble rolling over in bed when they wake up? All these hands go up. So, okay, that's it. The floor is our friend. And the floor is what we're going to do is we're going to learn how to work on the floor. First of all, we're going to practice that we fell down, roll over, and then teach people how to get back standing up safely, hopefully without a prop, but if with a prop, right? Let's get back to safety.
Sure.
Well,
Yeah.
holy cow, I walk up there and I didn't speak Spanish so well at the time, but I'm like, oh, Aries, okay? Are you okay? Because she's crying and her daughter and her husband are with her. Yes, senor, gracias, gracias. The first time in 5 years she had rolled over by herself without assistance. How many of us take that for granted, Doc, right? I mean, I did.
Oh, man. Yeah. Oh, yeah. Yeah.
I mean, and she chose to be bedridden at 42. Well, I just saw her last fall. And she's still running. She's running like races. She lives by Mount Topo Chico. She's like beelining it up there, sprinting, because hope.
Yeah.
From one little thing. I mean, I I know you do this. You tell people, you suggest things to do, and that I can't reiterate enough to the listeners, along with Dr. Pomerantz, about how important it is to keep moving so that you don't lose those abilities. Because man, that depression, once it kicks in, it can rule. It can rule.
It can be devastating. The mindset is powerful, and yes, hope can be life-changing, reinvigorate people. And I also want to point out a few things. One, I mean, anything is going to take some work. If it was easy, then everyone would do it. And so everything takes some work. But if you can, one, have some hope, and two, give just little things. And to point out, I mean, you're not creating some magical machine or some amazing medicine. This is just simply providing some activity of daily living motion, and simple. It didn't cost you anything, didn't cost them anything, and it's powerful. And I wish people could see that there's so many things that we can do. We have the power over ourselves and can help others do that are relatively simple. And yes, it takes work. And yes, it takes a mindset that can be hard to get to. But if you can get there, man, it can be life-changing. You don't need a ton of money. You don't need the resources we have here in the United States to make some big, big changes.
I mean, it's so true. I don't know if you've seen or if you have what you think of that series about the blue zones.
I'm aware of it. I haven't actually watched the documentary, but I'm very familiar with it. Yeah.
Well, what's interesting about that, and let me just say, folks, I saw it. I can't remember how many parts. I believe it might be four episodes. And there is some, from some medical people out there who are also very, very, very big on social media. All respect to them. I understand maybe they didn't look at all these aspects of everything that could be possibly looked at, so that maybe there's a little bit of a favoritism towards something. I don't even know what it is. I can't remember. I can't put it in words. But regardless of any of the holes that are punched into the theories of the blue zone, there is one thing all of those communities have in common. They are moving, and they are moving a lot, and they're moving every day. Most of it's not even like exercise as we know it, or as we tend to refer to it, the gym, the dojo.
Yeah.
I did Goju-Ryu karate for a long, long time.
Cool.
And
Awesome.
and it was great. I just wanted to do something else, so I do other things now. But in fact, the reason I needed a half an hour extra today, I'm sorry, is I had a chance to go to CrossFit with my daughter. She's the one who recruited me.
Nice.
Because I'm telling you, man, I got a Spartan beast coming up with my son in Killington. Half marathon, 30 obstacles this fall. I've done just a little less than the beast, but I got to crush that thing, man. So every day counts.
Yeah,
I got
there you
108
go.
days. I'm out of my countdown, 108 days that I've got to crush that thing. So thank you
Nice.
for the extra half hour today because it allowed me to work on
Yeah,
this shoulder strength that I'm starting to feel strong, like a full grown
good.
man almost. So,
Yeah.
but the
And
thing
you
is those
gotta,
communities, those are moving. Those people are moving. And what else can you say? I
yeah.
mean,
No,
it
it's
seems to
clear.
be a good thing.
Movement and the little bit of I saw, it's they're interacting with their friends, they're climbing that hill
Yes.
to then hang out and have
Yes.
coffee with their buddies, they're actively fishing, whatever they're doing, they're active and they're interacting and they're outside, and those are all pretty low cost things and we can all do, and their motivations aren't necessarily to, oh, I want to live to 100, so I'm gonna go walk. I want to be with my friends, I'm gonna go for a walk.
Yeah.
um and so it's those little things, and it's awesome that you're doing CrossFit and you're doing it with your kids and you got a an event to work towards, and that's extra motivation. So that's really cool.
I introduced my son to your oh, I meant to say this on the air too. I'll put it in the description, the Cut to the Bone YouTube channel.
Yeah,
And he's
yeah, yeah, yeah,
I think that you may hear from him at some point. He's just really freaking busy. And
yeah. I get
we're
it.
informally on I'm on the air on YouTube right now. So listeners, I know you know about my son, but the two of you I think would really hit it off because he's 37, he's MD, he's a PhD, he's emergency room specialty, but his full-time gig is developing artificial intelligence emergency room equipment like
Wow.
for
All
diagnosis
right.
and
Well,
treatment. It's very
yeah.
cool. He was at Emory for 3 years in Atlanta. I mean, that hospital is freaking busy, right? So
Yes.
the thing is though, like what I admire about you and my son, and I look up to my son as an inspiration, as a mentor, which I love, and my daughter too, because she holds me accountable on these CrossFit things. And her husband was there today too, so that was cool. But the idea of you practice what you preach. I mean, I love the photo you have sent me of your bloody eye, and it looks great.
Yeah.
But you're active, you're doing the stuff. You look lean, you look healthy. Um, you're practicing what you tell us to do, and my son does, and Peter Attia does, and the doctor upstairs who I took over this radio show from, he does. And that's there's a lot to be said for that. I admire and respect you so much for that, in addition to so many other reasons,
Yeah.
because no disrespect, folks, but you know the doctors who are out there smoking outside and then they come in and tell you not to smoke. I mean, what are you going to
Yeah.
say? None of
Yeah.
us are perfect, but walking the
No,
talk is a
no.
big deal.
We all have our flaws, and I'm fortunate to get a lot of intrinsic motivation from
Eh,
exercise, so it makes it easier for me. Um, but I also think physicians and coaches and however it is, we're leaders in a way, educators and leaders, and I think it's most effective to lead from the front and practice what you
Ah, man,
preach.
I love that. If you
Um,
don't mind, I'm going to give you credit for it, but I'm stealing that one. I'm going to borrow it. We need to
okay,
lead from the front. That's
yeah,
genius.
um,
It's so
and
obvious, and I never really thought of it like that.
right. No, it wasn't certainly my idea. I mean, I'm adjacent to a lot of military folks here in San Diego, and
Oh, sure.
leadership is a big thing, and I kind of can grab stuff that they are living themselves, and you can apply it to different areas. But yeah, as an educator who I hope to convince people that they can make life changes, if I'm not living it, then my voice is not as powerful. And I hope to be an example, and I hope to derive the same benefits. I don't have grandkids.
Hmm.
My daughter's only 7. but I still love throwing her in the air and tumbling around with her,
Oh, that's
and that's
perfect
it.
for
That's
you.
a huge motivation for me. So
I was going to ask, if you don't mind me asking, I go, what drives you intrinsically?
yeah. Um, so it's changing. And I think that's another thing is as we go through life, our motivations change, and that's okay. I've now officially reached middle age. I'm 42. For a long time, I was just kind of on this track. It made it easier. You know, we talked a little bit about me being an introvert, and I could just go down this track of I could be in the library, study, take the test, go on to the next thing. Boom, boom, boom. Do this, jump through that hoop, go. And I also realized that I felt better going through it. My body felt better. My mind was better. I felt I could study better by getting some exercise in, and I had fun. And I was competitive when I was younger. I wanted to win these competitions, and so putting the work in the gym wasn't a problem. Getting stronger, trying to learn about nutrition, all these were motivations because I wanted to be better at competing. Um, but now I see, like, all right, I'm not going to be a world champion. That is clear. And that was kind of a hit. I remember when I kind of finished what was my athletic time competitively, and it was kind of a hit. Like, all right, I didn't reach my big goals, which I was aiming big. I wanted to win tournaments, and that wasn't going to happen anymore. And part of it was I also had to realize, like, it's time to be an orthopedic surgeon. Uh, I quick aside, I ended up in the hospital on IV antibiotics with a staph infection in the early part of my surgical residency because I was trying to compete in MMA, mixed martial arts, at the same time.
Mhm.
And it's kind of this realization that I can't do it, and I got to realign my priorities. And so the motivations became how I felt with exercise, maintaining social interactions. And now that I've got a daughter, I still want to play with her,
Sure.
and she's a little thrill seeker. So I gotta do some stuff.
Oh, beautiful,
I
man. I
gotta get her
love
high in
that.
the air if she's gonna have fun. So
Yeah. Good
yeah,
for you.
those have turned into my motivations. And sure, you start thinking about your mortality, and you start to know the statistics of bone health deteriorating, muscle health deteriorating. It's harder to maintain these things, and I'm looking to live a long, healthy life.
Yeah.
I have my grandma whose motivation, she's 107. Um,
Whoa.
and I've seen how important mobility was to her. She got her knee replaced when she was in her 90s. And that is the reason why she's 107, because she kept walking.
I love
And
that.
so all of these things have contributed to why I want to keep going, and
That's
where I
beautiful.
intrinsically feel happy doing these things.
That's first of all, bravo to your grandmother, man. That's beautiful.
Yeah, it's awesome. Yeah, sure, there's genetics there, but
Does she live
there's a
near
big
you?
part to her mindset. Yeah, she's in Los Angeles, so a couple hours away.
Oh, yeah, not too bad.
Yeah, not too bad. We get to see her,
Side
and
note, side note, I flew into LA last year. And nobody needs to hear this, but you will. So rent this Mustang because I like fast cars and early sporty cars. Even the six cylinders are fast these days.
yeah.
I have an old Mustang. I got a 66. It ain't so fast, but it sounds really cool. Right. So, anyways, I rent this Mustang. I had to go to San Diego to the URSA conference, but I was hanging out with some musician friends in LA. I never made better time getting to San Diego. It was a Sunday afternoon. Like I left around noon, and I don't know the road, but it's like 7 lanes on each side,
Yeah,
going
the
like
405.
115 miles an hour down this highway because Waze said there was no police. Well, fortunately, there's no police and there's hardly any traffic, but I never made it faster to San Diego than that day. What a thrill.
Yeah,
Talk about a dopamine rush. Whew.
yeah, and it's scenic too. Got the ocean,
Yeah,
and
yeah.
yeah, I've never done that fast, but
I wouldn't
it's a
recommend
nice
it, by
drive
the
when there's
way.
no traffic.
Yeah, yeah, I would not recommend it. I was really seeking a thrill, and I certainly had it. Didn't do
There
that
you
the
go.
whole way, but I had periods when I was hitting it really fast.
Yeah.
Um, I'm not sure if it's good for my longevity though. Maybe it was. Is that
Well,
make you live longer when you get a ton of dopamine rushing into you like that?
it certainly makes you feel alive.
Yeah.
And as long as nothing bad happens, hey,
Yeah, I
go for
know.
it.
So I went off on a tangent. Well, yeah, you know what? Probably need to wrap up soon so I can go work with
Yeah,
somebody here and help them
yeah,
move
yeah.
better. Doctor, it's been so great to meet you. Great to have you on the show. If you don't mind, just hang on with me after I stop the recording button. But
Sure,
yeah, thanks,
no problem.
man. And
Hey, it was
what's
fun.
your YouTube is cut to the
So
bone.
cut to the bone on YouTube. Cut to the bone. Um, Orthopedic surgery. We work on bones, and during surgery, the bone is the safe space. You don't have to worry about the nerves or the blood vessels if you're right on the bone. So
Oh, great. That's
cut to the
cool.
bone. There you go.
I love that. Good name, catchy name too. Yeah,
Yeah,
thanks again for joining me. And I can't thank you enough. Let's do it again sometime down the road, you know.
that'd be awesome. I
Meanwhile,
would love it.
thanks, Doc. And be sure everyone to go to YouTube and just look up on Dr. Lucius Pomerantz. There'll be a link in the description too to his um, information, his YouTube channel. Thanks for listening. And this is my first overtime, so it's kind of cool. You know, I'd just like to
Glad to be part.
the 40 minutes of radio. Just I'd like to get a second hour, but it's not going to happen. They don't have time for me, and I don't have time to do it actually. But this makes it nice.
Yeah,
So, all right, thanks everybody for listening. Thank you, Doctor, and
yeah.
have a fantastic day. And remember to keep moving.
Keep moving.
Take care, folks.